This is an educational video that covers how structural racism contributes to medical mistrust and health disparities, as guided by the 5-Minute Moment for Racial Justice teaching framework. The 5-Minute Moment for Racial Justice is a teaching framework to promote health equity and racial justice in medical education. The framework relies on a 5-step approach that discusses the clinical and learning context, the current standard of a medical diagnostic or treatment, the historical roots and bias of that standard, contributions to health disparities, and steps to take to promote health equity. This framework offers educators a structured way to talk about this topic in a concise manner across commonly encountered clinical scenarios. By the end of this video, you will be able to recognize how historical and structural racism contributes to medical mistrust and describe strategies to rebuild rapport when patients express medical mistrust.
A 60-year-old female with a history of diabetes is admitted for septic shock to ICU and started on broad-spectrum antibiotics. After 2 days, she feels remarkably improved. Her admission blood cultures returned positive for Pseudomonas. On bedside rounds, the learner physician tells the patient he would like to change the antibiotics to target Pseudomonas, and the patient is visibly upset and asks, "Why do you want to change the antibiotics that make me feel better? Are you experimenting on me?" How might structural racism be affecting patient care here? These conversations are tough to have. Let's watch how these two clinicians navigate this conversation.
This is a good opportunity for us to talk about the complex and nuanced topic of medical mistrust. This wasn't something I learned well during my training, but it's important for us to talk about since trust is the cornerstone to building effective relationships with patients and families. Let's spend a few minutes talking about this. I would love to hear your thoughts as well. Let's start with the term medical mistrust. How would you define it?
I think it just means the patient doesn't trust their doctor or the healthcare system in general.
Although we commonly define medical mistrust as a lack of trust, what it actually is a patient's belief that providers or healthcare systems don't act in the patient's best interest. Mistrust can be at the interpersonal level between a patient and a provider, but also at the institutional level. Now we're talking about how individuals or even communities experience and respond to healthcare systems.
Why would some patients believe that healthcare providers wouldn't act in the patient's best interest?
That's an excellent and complicated question. The problem with the term medical mistrust is that it wrongly places the blame and responsibility on the patient. Instead, we should really think of medical mistrust as a protective and adaptive mechanism against a system that has proven time and again to not be trustworthy. Can you think of some historical examples?
I know one of the most famous examples is from the Tuskegee study, where U.S. researchers withheld treatment for syphilis from Black Americans to better understand the natural progression of the disease. This was considered a violation of human rights and an example of racism in medicine.
Absolutely. Medicine has a long history of mistreating vulnerable populations, such as the forced sterilization of Native American and Puerto Rican women and the Cincinnati radiation experiments. But historical exploitation can't explain all medical mistrust. Present-day personal or intergenerational experiences of discrimination, oppression, as well as negative encounters with public figures such as law enforcement can all fuel medical mistrust. All of this is to say there is a lot more going on than what you might see, and medical mistrust is a healthy survival and resilience mechanism. It's natural for patients to put up their guards against a system and society that has perpetually restricted access to resources, housing, employment, and healthcare.
I'm starting to understand why patients and why even certain communities would not believe that the medical system is always on their side. I imagine it can prevent patients from seeing their doctors, but how does it affect health outcomes?
Mistrust can also have significant negative impact on health and engagement, which contributes to health disparities. It leads to delays in seeking treatment, decreased use of preventative health services, and decreased adherence to medical advice and prescriptions. this results in higher rates of chronic medical conditions, hospitalizations, stress and mental health issues, and even death.
I feel like I'm seeing a lot more mistrust lately. What can we do when we approach a patient expressing mistrust?
The first step is recognizing that mistrust is an adaptive mechanism, and trust in the medical community and providers should be earned and not automatically expected. When a patient expresses mistrust, we can use a 3-step approach to build rapport. Step 1, ask and listen. Ask your patient to share the reasoning behind their statement. Step 2, validate mistrust. We should acknowledge and affirm the patient's experience and that their responses are justifiable, meaningful, and relevant. Step 3, ask for permission to explain the physician's perspective and recommendation. Rebuilding trust can be a long and arduous process and can only happen if we shift power back to our patients. Our patients might disagree with us, but we should keep lines of communication open. So bringing this back to our patient in clinic today, what should we do instead?
From our discussion, what I learned is medical mistrust is a resilient and protective response to a system that has not always been trustworthy. Medicine has a long history of exploitation, but this alone does not explain mistrust. Every patient has an individualized reason why. To rebuild trust, we should listen, validate, and acknowledge these reasons for mistrust. So for this patient, maybe I can ask her why she would think we were experimenting on her and lead by listening.
Fabulous. Let's go see her together.
To learn more about the 5-minute moment for racial justice and other health equity resources, visit 5mmracialjustice.stanford.edu.